Good day, viewers, and welcome to DDM Health News Update. Under the program, Your Health, Your Wealth. In a bold move to enhance healthcare services within Nigeria's correctional facilities, President Bola Tinubu has approved the recruitment of 50 doctors and 100 nurses to serve in correctional centers across the country. This initiative, announced by the Special Assistant of the Minister of Interior on Media, Babatunde Alo, is a strategic response to the long-standing healthcare challenges faced by inmates. Speaking on this development, the Minister of Interior, Dr. Olubunmi Tunji-Ojo, reaffirmed the government's commitment to safeguarding the health and rights of one of the nation's most vulnerable populations. In addition to the new hires, he disclosed that the National Youth Service Corps, which is the NYSC, will now deploy medical doctors to correctional facilities during their service year. Furthermore, existing medical personnel within the Nigeria Correctional Service will be granted an extension of service beyond retirement age to bridge immediate staffing gaps. The minister emphasized that this initiative not only seeks to improve inmates' welfare, but also serves as a strategic measure to tackle unemployment among the nation's youth. In particular, states like Rivers, which have been grappling with inadequate medical personnel, are expected to benefit significantly. Meanwhile, in a separate development, the minister highlighted the successful completion of renovation at the Kuje Correctional Centre, featuring modernized cells, an upgraded water supply system, and a state-of-the-art hospital facility. These improvements underscore the Tinubu administration's long-term commitment to infrastructure development in correctional institutions. In another transformative policy shift, a national paramilitary academy has been approved to provide degree programs to paramilitary studies, mirroring the structure of the Nigerian Defense Academy, the NDA. This academy aims to produce well-trained security personnel and bolster national security efforts. Additionally, the minister announced a major reform in visa issuance, introducing a fully online application system. Under this framework, Nigerians' visa will now be processed, either approved or rejected, within 48 to 72 hours, streamlining entry procedures for foreign visitors. With these progressive measures, President Tinubu's administration continues to demonstrate its resolve to enhance security, improve healthcare, and implement systematic reforms for national development. Now, let's move to Edo State. In a decisive move to combat the scourge of obstetric fistula in Nigeria, the federal government has formalized a strategic partnership with the Edo State Government to establish a National Obstetric Fistula Centre, NOFIC, in Benin City. This groundbreaking initiative, marked by the signing of a Memorandum of Understanding, underscores the government's commitment to addressing a debilitating medical condition that disproportionately affects women across the country. Leading a high-powered delegation to the Edo State Government House, the Minister of State for Health and Social Welfare, Dr. Ishaq Salako, reaffirmed the administration's resolve to provide holistic care for women suffering from Vesico Vaginal Fistula, VVF, particularly in the South-South region. He emphasized that the establishment of the center represents a pivotal step to mitigating the devastating impact of this preventable condition, one that has far-reaching consequences for affected women, their families, and society at large. The minister commended Governor Senator Monday Okpebholo for his unwavering support, including the provision of a temporary facility and the allocation of 22 hectares of land for the center's permanent site. He attributed the success of this initiative to the leadership of President Bola Ahmed Tinubu, whose administration has prioritized the eradication of obstetric fistula as a public health imperative. Nigeria currently bears the largest global burden of obstetric fistula, with an alarming 150,000 existing cases and estimated 12,000 new cases recorded annually. To combat this crisis, The Federal Minister of Health and Social Welfare launched the Free Fistula Management Program (FFMP) in June 2024, aimed at providing free treatment for affected women while implementing preventive measures to curb new cases. Beyond clinical interventions, the government remains committed to safe motherhood initiatives, ensuring that Nigerian women experience positive pregnancy, childbirth, and postpartum care. This comprehensive approach is designed to significantly reduce the incidence of obstetric fistula and promote maternal health nationwide. Upon completion, the National Obstetric Fistula Centre in Benin will serve as a beacon of hope, offering specialized treatment, rehabilitation service, and surgical interventions. Additionally, it will function as a training hub for healthcare professionals and a research and advocacy center dedicated to the fight against obstetric fistula. This initiative marks a monumental milestone in Nigeria's healthcare sector, reinforcing the government's unwavering commitment to restoring dignity and quality of life to affected women while advancing maternal health across the nation. In a significant stride towards combating the alarming prevalence of kidney disease in Yobe State, the government has initiated an extensive research project in partnership with renowned researchers from the United Kingdom. The initiative aims to uncover the root causes of the condition and develop effective intervention strategies. Addressing participants at the launch of the Yobe State Kidney Researchers Training Program, held at the Stan Dunes Hotel in Damaturu, the Special Advisor on Science, Research and Innovation, Dr. Mahmoud Buka Mayana, underscored the importance of the study. He urged community members to support the research team, which will conduct a large-scale study involving 2,000 randomly selected individuals from Bade and Damaturu local government areas. Dr. Mayana emphasized that the research, fully funded by the Edo State Government, marks a pivotal moment in the state's commitment to advancing public health. The findings will be shared with leading UK researchers in line with a collaborative agreement established 2 years ago under the directive of His Excellency Governor Mala Buni. In his remarks, the Commissioner for Health and Human Services, Dr. Muhammad Lawangana, lauded Governor Buni's unwavering dedication to strengthening the healthcare sector. He further highlighted that the research team comprised a distinguished group of medical experts drawn from estimated institutions, including the University of Maiduguri Teaching Hospital, Yobe State University Teaching Hospital, Federal Medical Center Nguru, Jigawa Teaching Hospital, and Bayero University, Kano. Health experts and stakeholders view this research project as a transformative step in understanding the escalating burden of kidney disease in Yobe State. The initiative is expected to yield crucial insight that will inform policy decisions and enhance medical interventions for affected communities. With the growing health concerns surrounding kidney disease, this research effort stands as a beacon of hope for Yobe State, promising scientific breakthrough that could redefine healthcare solutions for the region. Now, medical experts have raised fresh concerns over the indiscriminate use of antibiotics among pregnant women, particularly without a doctor's prescription. Health professionals in obstetrics and gynecology caution that certain medications, including commonly available antibiotics, pose significantly risk to both mother and child. This comes as the World Health Organization warns of a growing global threat posed by antibiotic misuse. The indiscriminate use of antibiotics during pregnancy is a growing concern among health professionals, with physicians warning of severe consequences for both mother and unborn child. Experts in maternal health stress that while pregnancy often comes with health challenges, self-medication, especially with antibiotics, can be dangerous. Dr. Muche Wafo, an obstetrician and gynecologist at Alex Ekweme University Teaching Hospital in Ebonyi State, highlights that while pregnant women are prone to infections such as urinary tract infection, not all antibiotics are safe for use during pregnancy. She warns that some antibiotics have been linked to fetal deformities, bone marrow suppression, jaundice, and even pregnancy loss. The risks of antibiotic misuse extend beyond individual health concerns. The World Health Organization recently sounded the alarm over rising antibiotic resistance, citing misuse as a key factor. The recent WHO survey across 14 countries revealed that a significant percentage of antibiotics, over 40% in some regions, are consumed without medical oversight. This trend, experts says, is contributing to the rise of drug-resistant infections, a crisis projected to cause 10 million deaths globally by 2050. Medical experts emphasize the importance of antenatal care as a crucial safeguard. Dr. Stanley Ebugo, a consultant obstetrician and gynecologist at Nande Azikiwe Teaching Hospital in Anambra State, warns for the misuse of antibiotics. He cautioned that antibiotics, alongside other medications such as antidiabetics and antihypertensives, must be administered strictly under medical supervision, particularly during the critical first trimester when fetal development is most vulnerable. Doctors urge expectant mothers to seek professional medical guidance before taking any medication and to prioritize antenatal care at reputable health facilities. They caution that while concerns often drive women to over-the-counter solution, the long-term consequences far outweigh the short-term financial savings. With antibiotic resistance on the rise and maternal fetal health at stake, experts stress that awareness and responsible medication use are imperative. As the global medical community battles the misuse of antibiotics, the message remains clear. Proper medical consultation is not just a precaution, it is a necessity. As antibiotic resistance continues to pose a global change, medical professionals urge pregnant women to prioritize expert guidance over self-medication. Responsible use of medical remains crucial for both individuals and public health. Stay with us for more updates on this developing issue. And don't forget to like, share, comment, and subscribe to our YouTube channel, Diaspora Digital Media, for more updates. Until next time, I am Nene Michael Nezine. Bye for now.